Wow, so this is the first time so far that we've had a part 3 of our lecture, but here we go with part 3. We're still on drugs used as oral anti-diabetic agents, and now we're going to talk about glucose absorption inhibitors. These delay absorption of carbohydrates by slowing absorption of glucose in small intestines. You can use these alone or in combination with insulin, and the adverse effects are flatulence, abdominal distension, and diarrhea. And some examples of these might be preclose or glycet. That would be 2. Boigonides lower cellular resistance to insulin. They do not cause hypoglycemia. The side effects are anorexia and nausea. They're not recommended for elderly, and the glucophage decreases liver production of glucose but does not release insulin from the pancreas. Thiazolidinediones are indicated in insulin-resistant patients. Avandia improves function of beta cells and delays progression of diabetes, but the side effects are headaches, edema, and weight gain. It has been shown to work in insulin-resistant patients and patients no longer responding to the sulfonylureas. Meglitinides stimulate the beta cells to release insulin. They're short-acting medications and can be used with injection insulin therapy. Repaglinide and neteglinide are typical medications that you would see. DPP-4 inhibitors may be used alone or with metformin or the thiazolidinediones. There's less weight gain, less hypoglycemia, there's fixed doses, and a typical medication that you might see is the sitagliptin. Some other injectables for type 2 and type 1 diabetes. Incretin mimetics, it's used to treat type 2 diabetes mellitus, given subcutaneously twice a day. A typical medication is the exenatide, and it seems to cause weight loss. We also have the synthetic human amylin. This is given subcutaneously before meals and snacks. Cannot be given with other injectable hyperglycemic preparations, and a typical medication we might see here is the pramlintide. So what are some specific hyperglycemic agents? How about glucagon, diazoxide, glucose tablets, and gels? These elevate blood sugar levels. They work as an antagonist to insulin. They're used to treat hypoglycemic reactions and the hypersecretion of insulin from the pancreas in the cases of pancreatic cancer. This finally concludes our lecture. I know this has been a long one and there is a ton of information, but it's important to just really look at the basics of what we need to know so that we can best help and educate our patients. I hope you have a great day, and I will see you later.